CARF Accreditation is not just an application, it is a proof system, showing payers, referral sources, and regulators that your program actually works. Without it, programs may struggle to demonstrate quality systems, qualified staff, and continuous improvement to payers and referral sources. This guide covers what CARF Accreditation is, who pursues it, 5 standards areas, the 12-month readiness path, cost planning, and software-supported evidence trails. Behave Health is not affiliated with CARF International. Verify current requirements with CARF before making accreditation or pricing decisions. CARF International is an independent nonprofit accreditor of health and human services. Peer surveyors review programs against current CARF standards. They observe services, interview persons served, review documentation, and evaluate conformance. CARF can issue 3-year, 1-year, or provisional accreditation or non-accreditation. The 3-year award is the target for well-prepared organizations. Without accreditation, programs may struggle to demonstrate quality systems, qualified staff, reliable documentation, and continuous improvement to payers and referral sources. Operators pursue CARF when they cannot simply assert quality. They need external review to prove it to payers, Medicaid, referral sources, investors, and regulators. A generic EHR stores records. An accreditation-ready system organizes the evidence trail surveyors will actually ask for: clinical records, staff files, incidents and outcomes, in normal operations. Software designed to support CARF readiness maintains clinical records, staff files, incident workflows, and outcomes dashboards before the survey window opens. For behavioral health organizations, standards work becomes operator work in 5 areas. The practical readiness question is not only, do we have the right policy? It is, can we show the policy is current, used, reviewed, and connected to real records and results? Area 1. Governance, leadership, strategy, and quality improvement. Evidence includes quality improvement minutes, action plans, remeasurement summaries, and leadership review records. Area 2. Rights, accessibility, privacy, safety, and service experience for persons served. Evidence includes signed rights acknowledgments, grievance log, consent records, and privacy incident log. Area 3. Staff qualifications, credentialing, training, supervision, and competency evidence. Verify credentials, licenses, background checks, job descriptions, orientation, recurring training, and competency checks for high-risk workflows. Area 4. Clinical operations, assessments, treatment plans, progress notes, discharge, and transitions. Confirm assessments support needs, strengths, risks, and diagnosis. Confirm treatment plans are person-centered and updated on schedule. Area 5. Outcomes, performance management, incident review, policy management, and evidence of improvement. Collect outcome data consistently, review trends in quality meetings, assign actions based on data, remeasure, and document whether changes worked. CARF's survey preparation page lays out a 12-month preparation path. Your actual timeline depends on documentation maturity, policy age, program complexity, and leadership capacity. Start by deciding which programs to accredit, contacting CARF, and establishing Customer Connect access. Form a survey committee and review the applicable standards manual. Conduct a pre-survey self-evaluation, then submit the survey application at least 3 months before the preferred survey timeframe. Prepare documentation, brief staff and stakeholders, and organize survey week logistics before the survey window opens. CARF accreditation cost is not a single flat number. Do not rely on fixed cost claims from older blog posts or outdated spreadsheets. CARF Steps page says the survey fee is based on the number of surveyors and survey days needed. Contact CARF for a current estimate. The most expensive accreditation programs are often the ones that start late. Compressed readiness increases over time, consultant reliance, rework, and missed gaps. Software supports CARF readiness when it helps maintain evidence in normal operations, not only during survey preparation. A behavioral health EHR organizes assessments, treatment plans, progress notes, consents, discharge plans, signatures, and timestamps surveyors may review. Staff workflows track credential expirations, training records, supervision logs, and competency evidence. Incident workflows handle intake, severity tracking, investigation, corrective action, and trend reports. Outcomes dashboards support performance data, and quality improvement minutes CARF expects as evidence of continuous improvement. Stop building your evidence trail under survey pressure. See how Behave Health supports clinical records, staff files, incidents, and outcomes for accreditation-ready organizations. Book a 20-minute demo at behavehealth.com. Book a 20-minute demo at behavehealth.com.